everyone, I'm Laura with Kansas City Mom Collective, and today we are at University Health Lakewood Birthplace, and I'm with Claudia Cornejo, a midwife here, and her patient that just recently delivered in December. Congratulations. Takia Steele. What did you have?
A boy.
How's he doing today?
That's fine.
Great. So we're going to chat a little bit about just why people choose midwives, the benefits patients see, and we're going to get both the practitioner and patient perspective. So we'll start with Claudia. Tell us about your approach to prenatal care and the delivery that characterizes using a midwife.
I'll say one of the biggest distinguishing factors between having a midwife for care and having an OB is we really value and try to promote and instill in others the normalness, the normalcy of pregnancy, postpartum, and we want to really acknowledge individual differences, but also acknowledge as a community what's the same between pregnancies, what can we learn from each other as moms and as patients.
Okay. And from a patient perspective, what do you see as the distinct advantage a midwife offers them?
Time. We just have more time built in to get to know our patients, to get to know their families. I want to meet your grandma. I want to meet your doula. I want to meet your kiddos when they come into the appointments. If your baby wants to help doppel the heart tones, let's do it. And we do. We just have more time built in with our clients, and I think that's great for the patient, but it's also really satisfying as a provider.
Mm-hmm. Did you feel that time was definitely a benefit you saw?
Yes, and the more personable approach, holistic approach, yes.
Okay. How much flexibility do you offer patients in their birth experience?
I think, we have people that have a variety of desires or have visualized different things for their birth experience. You can do whatever you want. I'm going to give you the risks and the benefits. I'm going to let you know what our hospital policies are, how things might play out, but ultimately you're in control, and I want everyone to feel empowered to steer their own ship.
And how do you manage their expectations?
Again, it's being honest. I'm going to let you know what I'm seeing, how the labor is progressing, how the pregnancy is progressing. I'm just going to be real honest with you, and I'm going to give you my recommendations based on my body of experience. And oftentimes I'm leaning on my OB to say, hey, what are you seeing? What concerns or questions do you have for this patient? And I think when you have that kind of constant communication throughout the labor course, it builds trust, and it helps us kind of meet in the middle, right?
Okay. And when someone comes for labor, what are their options for pain management?
Here at Lakewood Birthplace, we can offer IV pain medications. There are times when that's indicated and when that's not indicated throughout the labor course. And of course, the epidural, which we have a fabulous team of anesthesiologists and CRNAs that are available, and they're here for our patients.
Okay, so tell us a little bit about how you collaborate with the other teams here.
So we work really closely with our OB providers. They are aware of all of our patients that we are admitting. They have reviewed their charts, their medical history, their birth plan as well. And so if we have any concerns, our OB is kind of ready and waiting with anything that they might need. And then, of course, there's times when we don't anticipate on needing our OBs, and we need them anyway. And they're always right there, ready and willing to step in with, for when we need patient care with that.
And right before the video, you were chatting about how busy you are this morning with so many patients. Tell us, why do you think it's become so popular to choose the midwife option?
I think social media has a lot to do with that, and more people want to explore what it is to see their body enter labor spontaneously, to see, what that breastfeeding journey looks like, to see what their options are for birth control. More and more people are really, really becoming, I think, smart consumers of their healthcare. And so when they see a healthcare team that also encourages that flexibility and curiosity, then, I think there's a lot of benefit for both of us.
Okay. And you have 4 midwives at your clinic, correct?
Currently.
Why do you think University Health Women's Care Lease Summit has attracted so many midwives?
I think we've got a really strong team that shares values and speak to the larger OB, team in our hospital system. We really have the same goals for patient care. We, just from a provider perspective, we've got a good work-life balance. And I think that happiness that we have among our team trickles down to our patient approach as well.
Okay. We're going to ask you some questions now. First of all, tell us about little man. What's his name?
His name is Damon. He is 4 months old, and he is a little charm.
So tell us, why did you choose a midwife?
So I wanted to approach birth with a more holistic approach. I wanted someone to be personable with me. I honestly wanted a minority service provider. I want my provider to be a minority just because I know the disadvantages that minority women face when giving birth. So that is how I landed with the midwife and a doula. So, yeah.
And did you know about midwives before your first visit?
Yes, I did. I intentionally got on Google and searched midwives near me.
And Google worked for you.
Yes, it did.
Tell us, what would you tell others in your shoes, expecting a baby or planning to conceive and looking at their options? Why choose a midwife for their care?
Again, the flexibility, the honesty. She looked at my birth plan and basically accommodated everything that was on there. She did tell me, she's like, I know you don't want this, but this is what's happening, so think about this. But I didn't feel pressured to do anything.
Mm-hmm.
Everything went exactly the way that I expected it to, not as far as like being in labor for 3 days, obviously.
Right, no one expects that.
But as far as not getting the epidural, the only thing that changed was I did do the Pitocin. And people go, so, oh, you're going to have to get the epidural. And I'm like, no, I'm not. I don't like medicine personally.
Okay.
Another thing that changed was Benadryl. Like I said, I don't like medicine. So that says a lot for me to trust her enough and take medicine while I was pregnant, because I did not. And I held out for a very long time, and then I finally took it. But overall, the flexibility, the honesty, she was very honest about all the potential outcomes and all the things that I could do. She was very personable.
Mm-hmm.
My family was a piece of work. They were a piece of work. I also think that she worked with his father very well. He was coming off of a 20-hour workday every day that week. So for him to be so comfortable even taking a nap while I was still in labor, that meant a lot.
Mm-hmm.
That meant like she was doing her job.
That's awesome. That's great. I'm glad you had a great experience. Yes. And I appreciate learning more about midwives and hearing from a patient experience. I think that's so hopeful for new moms that are going through this and trying to find the right care for them. So thank you so much for being here.
No problem.
To find out more about University Health's midwives, call to schedule a tour and talk to one of their nurse navigators at 816-307-9600.